Today we'll be talking about statin medications and how they're useful in preventing heart disease. We will begin by talking about what it means to have a blood cholesterol test, why maintaining a healthy level of cholesterol is important, what statin drugs are and how they affect cholesterol levels, and who should be taking statin medications. We will also cover some side effects of statin drugs. Cholesterol is a naturally occurring fat in our bodies. However, too much can be bad for us. Your doctor will order a lipid panel to determine your cholesterol level. There are 3 different measurements that we look at. The first is total cholesterol, and our goal is to have that below 200. The second is the low-density lipoprotein, or LDL cholesterol. The low-density lipoprotein transports cholesterol to the body tissues. Too much LDL cholesterol is unhealthy. We want this to be low. High-density lipoprotein, or HDL cholesterol, picks up excess cholesterol from the body tissues and returns it to the liver for recycling. More HDL cholesterol is good for your heart, and we want this to be high. Why is maintaining a healthy level of cholesterol important? In this slide, you see a cartoon depiction of your blood vessel. When you have increased LDL cholesterol in your blood, as shown in yellow, it can deposit in the blood vessel walls. Over time, the buildup of LDL cholesterol can lead to a fatty plaque. Large fatty plaques in your blood vessels can become unstable and break open. Your blood will clot around the plaque and stop blood flow through the artery. Remember that blood carries oxygen to your organs. If the blood flow to your organs is blocked, it can cause death of the organs. If this happens inside a blood vessel supplying your heart, it can block the blood flow to your heart muscles. This is called a heart attack. If this happens in your brain, that is called a stroke. So how can we prevent this from happening? One of the best drugs we can use is called a statin. Statins reduce cholesterol production in your liver, decreasing the bad LDL cholesterol levels in your body. Examples of statin drugs include atorvastatin, rosuvastatin, simvastatin, and pravastatin. As you can tell, all of the drug names end with the word statin. So we just heard that statins reduce cholesterol production in your liver. But what else can statins do? A lot of people already have fatty plaques in their blood, but as long as they do not rupture, blood clots do not usually form. Statin drugs stabilize fatty plaques, helping to prevent heart attacks and strokes. Who should be taking a statin drug? According to the American Heart Association, if you meet at least one criteria below, you should be taking a statin drug daily. If you currently or previously had any cardiovascular disease, such as a heart attack, angina, stroke, peripheral arterial disease, or arterial revascularization, you should be taking a statin drug. In addition, if your LDL cholesterol level is above 190, or if you have diabetes and you are between the ages of 40 and 75, you should also be taking a statin drug. However, your doctor may prescribe you a statin drug if he or she thinks that you have other risk factors, even if they are not noted here. Are statin drugs alone enough to prevent cardiovascular disease? No. Lifestyle modifications alongside consistent statin use have been shown to reduce disease risk significantly. The American Heart Association recommends 150 minutes of physical activity a week, or 30 minutes a day for 5 days a week. They also recommend a healthy diet, including fruits and vegetables, nuts, legumes, low-fat dairy products, poultry, seafood, and non-tropical vegetable oils, such as olive oil. What side effects are possible with statin use? Statin therapy is usually safe, but a few people may experience some muscle pain or abdominal pain. The first thing you should do if you think you are experiencing side effects is notify your doctor. What are some myths regarding statin use? Myth 1. Statins cause diabetes. This is false. Statins do cause a slight elevation in blood sugar, but the benefits of decreasing cardiovascular events outweigh the mild increase in blood sugar. In fact, diabetes is one of the reasons why your doctor might prescribe a statin in the first place. Myth 2. Doctors just want to give everyone a statin. False. Statins are prescribed only when patients have a cardiovascular risk factor such as high cholesterol, heart disease, high blood pressure, or diabetes. Myth 3. All statins are expensive. This is also false. Statin drugs, especially generic options, can be very affordable. Talk to your doctor if the medication you have been prescribed is too expensive. there may be alternative options. Myth 4. Statins can cause heart damage. False. Studies show that taking statins can lead to significant reduction of heart attacks as well as strokes. In summary, cholesterol is a naturally occurring fat in our bodies. However, too much can be bad for us. Your doctor will order a lipid panel to determine your cholesterol level. LDL cholesterol is bad and HDL cholesterol is good. High LDL cholesterol can lead to the buildup of fatty plaques in your blood vessels. This can cause heart attacks or strokes. Statins can decrease the amount of cholesterol in your blood, which reduces your risk of disease. However, diet and exercise are just as important. Your doctor will let you know if you would benefit from a statin medication. Thank you for choosing to participate in this study. Now, we would like you to fill out a short survey. Your responses are anonymous, and choosing to participate or withdraw from this study will not affect your healthcare plan in any form.